Hey everybody, it's Dr. Jono from Gluck Orthodontics in Nashville, Tennessee. We've had a video on our YouTube for a couple years talking about how to take off your Invisalign, but specifically on the top. Now we've received a bunch of comments asking for a similar video of how to take off bottom Invisalign, so that's what we're gonna do here. So I'm actually not in Invisalign, but I made myself a clear retainer and I've got it in on the bottom, you can see. The only difference between this bottom retainer and Invisalign, well, really two things. Number one, this material is going to be a lot more rigid than the SmartTrack plastic, which is used in Invisalign aligners. Number two, I don't have attachments on my teeth, and I'll talk to you about that in a second. So when we think about removing the bottom aligner, our preferred technique is to use kind of a hook shape of your index finger and go on the back teeth on the inside. I'll show you this in a second, and kind of pry up in the back to lift it off the back teeth and then pull it up and kind of around. The reason why you can't do it on the outside, kind of like that, is because the attachments are in the way and it's really hard to kind of wedge or release the aligner from around the attachments, which are on the outside of the teeth. So what I'll show you again, kind of this little hook finger thingy, will go on the inside in the back. I'll pop it off the back teeth and then I'll grab it thumb and forefinger and kind of sweep it up and around. So here we go. There we go. Try the same thing on the other side. I'm left-handed, so that's why I'm doing it with my left hand. I'll try it with my right hand. Hook again.
He's got a credit card in there too.
Inside in the back and then kind of up and around. Again, we found this to be the most, the easiest, best technique for taking out aligners when the attachments are on the outside. It's pretty easy to release them off of the back teeth and then kind of pull it up and around. A couple other tips, really you shouldn't worry about breaking the aligner. Again, the material is very flexible. It's designed to be kind of pushed and pulled a little bit in either direction, so you really shouldn't worry about that. And the first thing, well really at the beginning of treatment when patients get their attachments on, often they say it's really hard to put them on and really hard to take it out. Hear that all the time. And the main thing is just to know that as you get further into treatment, that will get easier. The attachments will kind of round on their corners and you'll also just get better. The teeth will kind of loosen up. So I always tell patients the day they come in to get their aligners put on for the first time, that's the longest that it should take for them to learn how to put their aligners off and on. So again, this video showed us how to remove the bottom aligner. Could be the same thing for a retainer. We used that kind of hook method, went up on the inside in the back and then pulled it out and around. I'll show you one more time. There we go. Have a question? Leave it in the comments. Love to hear from you guys. Hope you have a great day.